Hi, I'm Natalie, one of the breastfeeding specialist midwives from Sherwood Forest Hospitals, and I'm here to guide you through the process of hand expression. Hand expression is an incredibly valuable skill. During the antenatal period, it allows you to familiarize yourself with how your breasts function and express colostrum, which can be beneficial for your baby after birth. In the postnatal period, hand expression is often used when babies are hesitant to feed or when you experience discomfort as your milk comes in, helping to alleviate engorgement and clear blocked ducts. Whether you're in the hospital or giving birth at home, a staff member can demonstrate how to hand express using a knitted breast. To start, gently massage your breasts. It's crucial to be gentle, as these areas are highly sensitive. Use your hands to massage in a circular motion, covering all 360 degrees where the milk ducts are. Alternatively, you can use the backs of your knuckles, moving gently downward. Soften the breast to get everything flowing. To stimulate oxytocin release, have your baby nearby or, if separated, keep something that reminds you of them, like a scent or a photo. Next, with clean hands and a sterile container ready, form a C shape with your hand. Starting about 2-3 centimeters back from the nipple, bring your thumb and forefinger together, applying gentle, steady pressure in a rhythmic motion. It may take some time initially, but eventually, beads of colostrum will emerge at the nipple's end. Use a sterile syringe or cup to collect the expressed colostrum. Continue in the same area until the flow slows, then move to another part of the breast, as ducts are distributed all around in a 360-degree pattern. After finishing on one breast, repeat the process on the other. Once complete, we can guide you on safely providing your baby with expressed breast milk using a syringe or cup.